When is a kidney biopsy needed during cancer surveillance? Imagine you're keeping a close on your kidney health after cancer treatment. Most of the time, doctors use imaging tests like CT scans or ultrasounds to watch for any signs of recurrence or new tumors. These scans are very good at showing the size and shape of kidney masses, but sometimes they can't tell if a suspicious spot is cancer or something benign. That's when a kidney biopsy might come into play. A biopsy is usually considered when imaging shows a mass that looks unusual or keeps changing over time, and the scans alone can't give a clear answer. If the mass has an atypical appearance, or if there's uncertainty about whether it is a new cancer, a benign growth, or a non-cancerous kidney condition, a biopsy helps confirm what it is. This is especially important because treatment decisions depend heavily on knowing the exact nature of the mass. Biopsies are also important if a person has only one kidney or if both kidneys have tumors. In these cases, preserving kidney function is vital. Knowing whether a new growth is cancerous helps decide if active treatment is needed or if careful monitoring is enough. If the biopsy shows the mass is benign, unnecessary surgery or treatments can be avoided, which helps protect kidney health. Another situation where a biopsy might be needed is when a patient is being considered for systemic therapy, such as targeted drugs or immunotherapy, especially if the cancer has spread. Confirming the diagnosis and understanding the tumor's specific type and grade helps doctors choose the best treatment plan. If a previous biopsy was inconclusive, or if a tumor grows or changes during surveillance, a repeat biopsy might be recommended to clarify what is happening and guide further steps. While kidney biopsies are generally safe, with low risks of bleeding or very rarely tumor seeding, they are not performed for every suspicious finding. The decision depends on weighing the potential benefits of getting a definitive diagnosis against the small risks involved. If imaging clearly shows a benign condition, or if the clinical picture suggests a non-cancerous issue, a biopsy might not be necessary. In summary, a kidney biopsy during cancer surveillance is most often needed when imaging results are uncertain, when knowing the exact nature of a tumor will influence treatment choices, or when managing patients with a solitary kidney or bilateral tumors. The decision is always personalized, with healthcare providers carefully balancing the need for accurate diagnosis with patient safety and overall care goals. Always remember to discuss your specific situation with your medical team, as they can provide guidance tailored to your health needs.